Hello, Sandy here with the United States Health Foundation. We're reviewing our manual, our course manual to prepare you for the Certified Health Coach exam. This is a review. It's not intended to instruct you on the course. It's very quick. We're on chapter 6. This is evidence-based interventions for chronic conditions. Chronic illness is the single greatest threat to our health, to our quality and quantity of life, to our economy, and to our standard of living. Currently, health costs are skyrocketing. Our premiums are now equal or surpassing our rent and mortgages, which is incredible. It's very costly to be ill today. And as we've discussed in our courses and today during the review chapters, that a majority of our costs are preventable. They're lifestyle. We can change behavior and modify our risk and our cost. Chronic illness is a lifestyle issue. Lifestyle is the cause of our chronic illnesses, and lifestyle is the only evidence-based solution for the prevention of and recovery from chronic illness. That's a bold statement, but it's true. Disease management, which our country operates on, our sick care system, not health care, sets you up to where you go to a physician when you're ill or hurt. There's very little preventive care going on. It's getting better, but still not so much. So it's up to you to identify risky behaviors and try to modify those. Work with your physician, get screened, know your numbers that we talked about earlier, and that will help you decrease your chances of chronic illnesses. Does diabetes prevention and management, because of the boom in our weight in this country, we're seeing so much more type 2 diabetes and so much earlier in life. We have adolescents and young adults now with high cholesterol, hypertension, and they're showing signs of insulin resistance or even type 2 diabetes. And if these aren't managed very well, we'll end up with some major negative health outcomes at an earlier life, such as diabetic problems with maybe going on dialysis, losing a toe or below the knee amputation, blood pressure problems leading to stroke and heart attacks, along with the cholesterol, and orthopedic issues as well. The Center for Disease Control estimates that obesity and diabetes now cost the United States healthcare system $1 billion a day. That was with a B, $1 billion a day. And we know that there's a strong correlation with obesity. We can look at our body mass index. When we get a BMI over 30, that increases it. Family history of diabetes and smoking. There was a wonderful study done years ago by the Diabetes Prevention Program, and they put people through intensive lifestyle interventions with physical activity, nutrition, and they saw a 58% reduction in the risk of developing type 2 diabetes was found compared to a control group who only received some basic information. That group, they were all pre-diabetic. So this is 58% of pre-diabetics that did not move into diabetes with just some not so difficult interventions. 150 minutes of regular physical activity is what's also required or suggested for diabetics. We might have to change that FIT principle to be maybe a little lower intensity, maybe more frequent, instead of possibly like running, which could be difficult on your feet, especially as a diabetic. Cardiovascular condition prevention, it's easy. Several studies have been done to support the fact that proper nutrition and physical activity are two of the easiest and most effective methods for reduction of risk factors for cardiovascular disease. What's another one? Cigarette smoking. Preventing cigarette smoking in children and adolescents, and now the vaping, which is running rampant throughout our middle and high schools. Overweight lies at the risk of several factors for heart disease as well. The New England Journal of Medicine released a study back just a few years ago with about 56,000 participants who had a strong genetic link to cardiovascular disease. When they broke them into favorable and unfavorable lifestyles, the people with a favorable lifestyle had about half the risk of moving on into cardiovascular disease versus unfavorable. So once again, genetics play a role in your risk, but lifestyle can help modify those risks. Orthopedic conditions, osteoarthritis is one of the most limiting conditions. I know most of you therapists work with that a lot. We do exercises of more low impact to help maintain or maybe strengthen musculature, help with joint flexibility, range of motion, and improving overall stamina. Chronic pain, as you know, doesn't go away after 3 months. You have acute, subacute, and chronic. Chronic pain is debilitating. It causes a lot of problems. We have musculoskeletal and neuropathic pain. People tend to isolate themselves. This is a test question. They go through psychological shifts. A person's mental health and overall attitude toward life could be greatly affected by, greatly affect their pain experience. They get that glass half empty perspective. So we don't ignore acute pain. We try to stay healthy. We try to get our sleep, reduce our stress levels. Cancer risk. According to the World Health Organization, 1/3 of all cancer cases are preventable. I assume that's around the world. I gave you a study earlier, I think in chapter 1, that 40%. So 30, 40, some studies are even suggesting 50% of cancer could be avoided through lifestyle changes. Tobacco use is the single greatest avoidable risk factor for cancer mortality worldwide, causing an estimated 22% of cancer deaths per year. And that's chapter 6 review questions in the presentation. All right, very good. We're getting close here. We got a few more to do, and we'll be done with the review chapters for our certified health coach exam.